Hello, my name is Ruth Aspy, and I am here to talk to you about considerations for autism evaluation in the public schools. I'm going to give you a little bit of background here. I have worked in autism evaluation in the public school setting and in the private practice setting for decades, and it is one of the most rewarding things that I have done in my career, and it's one of the most challenging things that I've done in my career. One of the things that I have had the opportunity to do for the past decade is to train teams of people who are doing evaluations of autism in the public schools in the state of Ohio. It's called the EDID training, the Educational Identification Training. And every year, teams of psychologists, speech pathologists, school administrators, autism specialists, etc., occupational therapists gather together to be trained on working together as a team to do autism evaluation. And a lot of what we're going to talk about today is highlights from that series that I do. And so there are so many things that we'll talk about that we could go into depth for several hours on, but we're going to skim the surface so that we can cover some ground and talk about a range of things related to autism evaluation. Want to start with this drawing by Brant Hansen. I don't know if any of you are familiar with Brant Hansen. He has a podcast and a radio program, and he is also autistic. He is hilarious. And one of the things that I have seen him say when he presents is using this visual. And what he says is, does this affirm what I'm already doing? If yes, applaud. If no, kill. And I've got to tell you that this topic is one that when I talk to different groups, I see this dichotomy of individuals who feel affirmed and individuals who what I'm saying is different from what they've always heard in their experiences where they work, and or it may be different from what they have done in their practice. And I see their faces. This is in when I get to talk to people in 3D, but I see their faces scrunch up and I see them frustrated, and I get the feeling I'm talking to a bunch of angry people. So what I want to say is, if some of the things that we talk about today don't quite match the way you've always done it or always heard it, if you would take a deep breath and consider thinking about it differently, or be open-minded to some new ideas, this might be the kind of discussion that will challenge some of the way you think. And some of you may go, yeah, we've been doing this forever. The prevalence of autism right now is 1 in 44 individuals based on the CDC. And you may know that this is taken from a handful of states, and these numbers are taken individuals at the age of 8. So that impacts a little bit who's identified at that point. And if you've been in the field for a while, you've seen these numbers change. When I was first in the field, the numbers were 1 in 160 something, I think, maybe even higher than that. So boy, is it different than it once was. And those of us who are doing autism evaluations are certainly identifying a wider range of individuals than were identified a few decades ago. If I can get this to cooperate with me there. The prevalence of autism in 2021, 1 in 27 boys, 1 in 116 girls. And we'll take a little bit of time later on and talk about that discrepancy between the number of girls who are identified and boys who are identified. And here are the numbers in the United States. 7.2 million students aged 3 to 21 were served under IDEA, under special education, during the 2020 school year, 2020-2021. Those are the most recent numbers that we have. And this just shows the percent or the prevalence of individuals in each category under special education. And we know that about 15% of all students are served under IDEA. And the most common disability area is specific learning disability, and then speech, then OHI, then autism, and then you see the others as well. So about 12% of students who are served under special education are served under the category of autism. I want you to take just a moment and write down somewhere, find something to write on, and to write down what are the 3 purposes of special education according to federal law. So just take a moment. I'm going to be quiet for a minute, and I want you to write down the 3 purposes of special education. The next question, if you'll keep your pencil ready, child find includes children of what ages? Age blank to blank. And if you'll just write that down, jot that down somewhere. Want to match what you wrote with what the law says. The purpose of special education is to ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services designed to meet their unique need and prepare them for further education, employment, and independent living. So there it is, the 3 purposes of special education in the United States. And this was established in 1975, when special education was first put in place. The introduction to special education law says that the 3 purposes of special education in the United States is to prepare students with disabilities for further education, employment, and independent living. From the very beginning, when we do evaluations, we keep in mind further education, employment, and independent living. And our recommendations, we want to be the next steps towards helping this individual to be able to participate in further education, employment, and independent living, to be able to be a part of the community to whatever extent they're able. And we keep this in mind when we put their programming in place, etc. And when we consider adverse effects, we'll talk more about that. And what Child Find law says, each school district shall adopt and implement written policies and procedures that ensure all children with disabilities residing within the district and who are in need of special education and related services are identified, located, and evaluated. And the ages are birth to 21. One of the reasons that I emphasize this when we discuss evaluation in the public schools is that very often when we think about child find, we think about the people in schools who are assigned the role of finding children at the age of 2 years old, 3 years old, of finding those students who at that point someone is suspecting a disability. And we forget that the law says that schools, public schools, have a responsibility to identify, locate, and evaluate students who may have a disability all the way to age 21. So the first time that we suspect a disability is when the student is in the 7th grade. Child find is in place, and we have a child find responsibility. If the first time we suspect a disability, a student is in the 11th grade, child find is in place, and we have a responsibility to consider evaluation at every age from birth to 21. So FAPE is something that we all are very, or, okay, I'm talking like everyone does know this, and everyone doesn't, but once you're around special education for a while, you get familiar with the term FAPE, free appropriate public education. And one of the things we need to keep in mind is there is no FAPE without evaluation. That evaluation is the foundation of free appropriate public education. And if we sometimes will hear someone say, well, I know that we suspect that he might have OHI or be eligible under the category of OHI. But you know what? He's already being served under emotional disturbance, or he's already being served under learning disability, and he's getting a lot of services. So we don't need to do any further evaluation to look at that, because he's already being served. That's not what the law says. The law says if you don't evaluate in every area of suspected disability, you're not providing FAPE, because a good program is based on good evaluation. Our role then is critical, and there may be a student who's already in services, but if someone suspects, you know what, I think we may have missed autism. I think autism may be a correct disability area. Well, then you know what? Then we are, Title IX tells us that we need to do an evaluation, and there's no FAPE without it. How does Virginia define a child with a disability? Children with disabilities means those persons who are aged 2 to 21 inclusive, having reached the age of 2 by the date specified, who have intellectual disability or serious emotional disturbance, are physically disabled, speech impaired, etc. So they list the various disability areas, and they say who, because of such impairments, needs special education. So we'll look at that differently. And the only difference here is we've taken these disability areas and listed them, and you see intellectual disability, serious emotional disturbance, physical disability, etc. And one of the things in the list is autism spectrum disorder. So it's just one of the disability areas that a person might be eligible under. And how does Virginia define autism? It defines autism as a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, which adversely affects a student's educational performance. And this is really nice because Virginia's definition is very consistent with the IDEA definition. Some states vary in creative ways, and ways that are less convenient, but Virginia is very faithful to the federal law here. So you see that the areas that are impacted: verbal, nonverbal communication, social interaction, and it adversely affects educational performance. So what does adverse effect on educational performance mean? Well, educational is not the same as academic. Academic is a subset of ways that autism could adversely affect a student, but it could be their communication functioning. It could be social, pragmatic language, organizational skills, group work skills, problem-solving skills, emotional regulation, hygiene, behavior, attention challenges, daily living skills, adaptive behavior. So any of these. And why would these adverse effects, why don't we just focus on academics? Because the purpose of special education is to prepare a student for further education, employment, and independent living. And academic performance is one thing that impacts that, but you know what else impacts that? All of these other things. And what if a person is a straight A student and just making setting the curve on the state exams, and every teacher's hoping they have this student because they know how good it'll look on the exams. But what if that same student walks around with mucus and food on their face all the time? Well, their ability to work in small groups is going to be impacted. Their ability to be employed is going to be impacted. What if they can't work in small groups? What if every time there's a group task given, they say, I'd rather work by myself? and the product they do by themselves is excellent, but they never do develop group work skills. Well, does that impact further education, employment, and independent living? It absolutely does. It's hard to find a job. It's hard to find any job where you don't have to, at some point, successfully interact, communicate with other people in the setting for some reason or another. So the fact that someone's making straight A's does not mean that they're going to be able to move into the community after high school and meet their potential if we haven't also addressed these other things that impact further education, employment, and independent living. So this is one place where school districts sometimes struggle, is making sure that the students are referred for reasons other than academic. And the law is very clear on this, that academic performance is just one thing to be considered when we look at eligibility decisions. So just showing you, this is an example of something that some of the teams that I've worked with will put at the end of our reports, a table that is the educational need or adverse effect table. And we'll put the areas where we saw adverse impact, things that could impact their functioning in the educational setting. And we'll put the sources of that information so that it's clear that there are things that need to be addressed. And when we look at an IEP of a student who is being served under the category of autism, we should be able to pick up their goals and objectives and read their goals and objectives. And we should know from reading their goals and objectives, this student's being served under autism, because it should look different from the goals and objectives being written for someone who's in under ED or who's in under OHI or other categories. We should be able to recognize their eligibility area by the goals that we've written. And because we should be addressing the things that the underlying autism that's causing an adverse effect. So, for example, here under pragmatic language, you see that this student talks incessantly. It has little back and forth in conversation. Well, it would be very helpful, depending on the big picture, of course, with any student, but to have a goal about that, and for them to be served maybe by a speech pathologist, or maybe in a setting where they get to do some social activities and some learn to understand their conversation skills better. One of the things that we know is that difficulty with conversation has a huge impact on the ability to be successful in further education, employment, and independent living. So conversation goals are a worthwhile thing to address in an IEP. All right. I think we've already talked about this a little bit, but the law says a child must be tested in all areas of suspected disability. We don't get to ignore the possibility of autism because a child is already receiving speech, or because a child is already under OHI, that ADHD has already been recognized. That is not what the law says. The law says if there are people who reasonably suspect that autism is also present, that we need to go and to however referrals are done in your setting and ask for the evaluation and add that evaluation. And if indeed the autism is identified, then that needs to be added to this individual's eligibility and added to their things that are addressed in the school setting directly. We will talk now about some debacles that are related to evaluation of autism in the school setting. And a debacle is a great disaster or complete failure. So there are two debacles, and you can see here, this is an image of the Titanic hitting the iceberg. And that's how devastatingly disastrous these things are. Debacle number one is holding off And you can see in the gray here, holding off is egregious. So what are we talking about? How does your district identify learning disabilities? How does your district identify speech impairment? How does your district identify emotional disturbance? Think about how that process happens in your setting or in settings that you're familiar with. And then how does your district identify autism spectrum disorder? And sometimes school settings, if someone suspects a learning disability, school settings have a ready response for that. If someone suspects a speech impairment, there's a ready response for that. But when someone suspects an autism spectrum disorder, the response differs. Keep in mind the list of disability areas that are in the law, in the federal law and in Virginia's law. And one of them, just one of the things in the list is autism spectrum disorder. So it is one of the disabilities that schools have responsibility for. But here's something that happens is there's a widespread, I'm going to move something on my screen again. There's a widespread egregious practice in the United States. Inaction of the public schools until receipt of an outside medical diagnosis of autism, or even worse, the response to an evaluation request with a counter request for a private diagnosis. This is illegal and may deny a student FAPE. So even last week, I talked to someone who shared about a parent in another state who came to the school and said, you know, I'm wondering if my child has autism and I'd like an evaluation for that. And the school, the school system responded by saying, we don't do that. And I've also heard schools respond with, well, okay, if you suspect that, go get a diagnosis and come back and bring us a report. So here's how I think about that. I think of the Godfather talking to someone and saying, I can't speak, bring us a diagnosis, we'll talk. Something with some scruffy voice like that. And it is so illegal, it's so wrong. And it is never, and maybe you all are going, why is Ruth talking about this? We've never seen that happen. Well, I'm so glad if you've never seen that happen, because you shouldn't see that happen, but it happens all the time. We somehow think of it as different from the other disability areas, and it isn't. It's included in that list. So remember, Child Find says that that we're supposed to find students with disabilities and make sure they're identified, located, and evaluated. And the list of disabilities includes autism. And so we never send someone away until they can come back with a diagnosis that someone else has provided. It's just not legal. So the autism identification process, there's two categories. You see here the legally required and the optional, but recommended. So if a parent has a concern, I'm wondering if what I'm seeing may be autism, they can contact the school and request an evaluation, and then the process in the school system starts. You can see that arrow that goes over to the suspected disability Child Find box, or they don't have to tell the school that. They can go to their pediatrician, or they can go to a neurologist or a psychologist or a social worker or whoever in their community knows autism, and they can obtain a private screening evaluation. They can get the report, the diagnostic decision, and it's up to them. Do they want to contact the school and share that or not? That's theirs to, that's their information to share, and they can seek services privately. That's all optional. But on the other side, on the left side here, you see the legally required evaluations that have to occur, and that's Child Find, and then the school district follows the referral procedures. The school completes the evaluation according to IDEA, and an eligibility determination is made. So it is not optional. The only place that is legally required to evaluate for autism if it's suspected is a public school in the United States. Nowhere else is it required. Only the public schools have to follow these steps. Parents, it's an option for them. It's optional. It's not optional. It may be very recommended, but it's optional. All right. So the schools are the ones that are required to identify autism. And we never say, go seek a private evaluation. If you get a report that says autism, come back and we'll talk. That's never legal to approach it that way. The debacle number 2 is the false dichotomy. And that is a medical diagnosis is different from educational autism. Let's talk about that. Have a seat, Kermit. What I'm about to tell you may come as a big shock. This is something that some people are not used to hearing, but there's no such thing as a medical diagnosis of autism. Just recently, I had a parent tell me that genetic testing helped to confirm the presence of autism and was helpful for her child and her family. And I'm beginning to hear that report, but it is only a confirmation. What do we know? And we hear people all the time talking about medical diagnosis of autism. There's no such thing. Here is Centers for Disease Control talking about the myth of medical diagnosis. Diagnosing autism can be difficult since there is no medical test, like a blood test, to diagnose the disorders. Professionals look at the child's behavior and development to make a diagnosis. And this is the Autism Society. The myth of medical diagnosis. There are no medical tests for diagnosing autism. An accurate diagnosis must be based on observations of individuals' communication, behavior, and developmental levels. And this is from an article where the authors say, currently, there are no biomedical markers or laboratory tests for identifying children who meet the diagnostic criteria for autism. Accurate identification is entirely dependent on obtaining a complete developmental history and on direct interaction and behavioral observations. The importance of informed clinical judgment by health or mental health professionals responsible for diagnostic evaluation or eligibility determination of autism cannot be overemphasized. So when we use the term medical diagnosis, I'm going to go back here, we are using a term that really isn't very meaningful. And I just want you to think about, and now occasionally there are medically trained people, medically licensed people who do work in the school setting. And so those people can discuss medical things without malpractice. But I'm a psychologist. I'm not a medical person, but I diagnose autism all the time, or I help make eligibility decisions all the time. And I am not practicing medicine. If autism were a medical diagnosis, then what business would I have ever being a part of that process? Why would it be included in a list of things that school professionals can be a part of evaluating if it were a medical diagnosis? It's not a medical diagnosis. It's in the DSM-4TR, the current version, that's used by social workers and psychologists and by many people who do not have medical credentials. And when we call it a medical diagnosis, we give parents the impression that if we're not trained in the medical field, we shouldn't be talking about autism. Why would a parent trust anyone in the school setting to determine the presence of autism if it's a medical category that medical people should be determining? So what I'm asking you, do you hear my voice? I get really a lot of feeling about this. But I encourage you not to use the term medical diagnosis. And I encourage you, now this one's harder, but if someone around you uses the term, try to encourage them not to use it, because it's inaccurate, and it gives the impression that only people in a hospital setting or a clinic setting who are medically trained can recognize autism. And I've got to tell you that some of the best autism evaluations I've seen are done by people in public school settings who are well-trained and experienced, and who are very capable to recognize autism when they see it, but they don't do medical diagnosis. So we need to watch our language. All right, back forward. So how do we diagnose autism? We diagnose autism in the private setting. We use the term diagnosis, and we use the diagnostic manual that I just held up. And this is a series of diagnostic manuals. And, you know, in the 50s, autism fell under the category of schizophrenic reaction. In the 60s, schizophrenia childhood type. In the 80s, infantile autism. In the 90s, it was put under PDD. Some of you may remember that, pervasive developmental disorder. And it wasn't, and we gradually added in the DSM-4TR, we added Asperger's, and we were able to talk about a wider range of people on the autism spectrum. And then finally in 2013, in the DSM-5, autism spectrum disorder, was added. And so what used to be under PDD, Rett's, childhood disintegrative disorder, pervasive developmental disorder not otherwise specified, Asperger's, was collapsed into autism spectrum disorder. And now we have the DSM-5-TR, and we still are using autism spectrum disorder. Just a reminder that the definition of autism says that in Virginia says that that autism adversely impacts the student's educational performance. And so let's compare diagnosis with eligibility. In diagnosis is based on a set of criteria. We just looked at that, the DSM-5 criteria, or if you're not in the United States, the ICD is used. And if you work in the public schools, you are basing, you are making not a diagnostic decision, but an eligibility decision. Does this person have a disability, and is there an adverse impact on educational performance? So diagnosis is based on the DSM, and eligibility is based on IDEA, federal law, and the state definition of what autism is. Diagnosis refers to a single condition with different levels of symptom severity in social communication and repetitive restricted behaviors. Now, we just looked, if you were practicing in the private setting a couple of, before 2013, then it wouldn't be a single condition. Then you would be going, is this autism? Is this PDD and OS? Is this Rett, etc.? Or is this Asperger's? But now it's been collapsed into one broad category. We'll look at eligibility. Eligibility, if you're looking at, is this person eligible under the category of autism in the public schools, you look at a broad category of autism. And so wherever they are on the spectrum, you're looking at, do they fit under the category of autism or not? Diagnosis is used in private settings. Eligibility is only a term used in the public schools. Diagnosis may be determined by an individual or a team. And I gotta tell you, some of the worst diagnoses I've ever seen have been done by an individual. I've seen a diagnostic decision scribbled on a prescription pad, and parents were told, here, take this to the school and tell them that they need to serve this child under the category of autism. And oh wow, that's not how it's done. Not that you don't, that what people are seeing in the private setting doesn't matter, but in the public schools, autism evaluations have to be done by a team. It is so much better to work on a team to do an autism evaluation than it is to work individually. Because think about what autism used to be called. It used to be called a pervasive developmental disorder. What does that mean? It means that a person is impacted in their in how they communicate, in their emotional functioning, in their ability to regulate, in their motor skills, in their sensory functioning, in their emotional functioning. I'm leaving a lot out, but communication, etc. So a person's functioning is impacted across a whole range of areas. So it's so much better if a team is involved in doing the evaluation, because you can have experts in different areas contribute to gathering information on that student. And then in diagnosis, it has to be determined there's a clinically significant impairment in functioning. So let's just talk about a diagnosis like depression. There are people who, lots of people every day who are depressed or who are grieving, but that doesn't mean that they would have a diagnosis of major depression or a diagnosis of bipolar or whatever, because it has to be a clinically significant impairment in functioning. So the person has to not be able to get out of bed in the morning, or has to not be able to work, or has to stop enjoying things that were once very pleasurable for them, and they kind of start to withdraw from life. Then you go, oh, this is a significant impairment in their functioning. This is diagnosable. Well, in the school setting, we have something comparable. It's called adverse effect. And we go, well, yeah, everyone may every now and then have difficulty communicating, or may have some sensory differences, or whatever it is that we're seeing, but it has to have an adverse impact on their educational performance. So this is just comparing the two. And what you see, or what I hope you're seeing, is they're actually very similar concepts. The words used to describe them are, the DSM uses a different set of descriptions for the characteristics, but I hope you'll trust me if you compare the characteristics that are described in IDEA or in Virginia's description of autism to the description of autism in the DSM. You know what? They overlap. They're interrelated. You can't find something described in the characteristics in the Virginia definition of autism that's not also described in the DSM criteria for autism. So autism is autism, whether it's a diagnosis or an eligibility. Now, I know we're not used to thinking of it that way, but autism is autism. I'm telling you, if someone has autism in the grocery store, they have it in homeroom. If somebody has autism in math class, they have it in Sunday school, wherever they function in the community. Autism is autism, and there's much more overlap between diagnosis and eligibility than we have tended to recognize. And you may recognize this image as the Emperor's New Clothes. And this is from, you probably know the story, but real quickly, it's a tale about these fellows who come to town, and they tell the emperor that they're going to make very fancy new clothes for the emperor. And they have everyone in the town convinced that they're doing this elaborate outfit for the emperor, and they plan a parade for him to show his new clothing. And he walks down the street completely naked, and everyone in the town is cheering his new clothes. And you can see in this picture this one little kid who's got his mouth open, and you can imagine what he's saying. thinking, because he hasn't been tricked by these people who are saying that they're making the emperor new clothes. He's seeing this nude guy walking down the street. And the reason that I put this in here is because I think of this story when I think of how for so many years I felt when people said, oh, we're talking about educational autism. We're not talking about the medical diagnosis. And I would think, what are they talking about? Why are they talking about it? Because as if it's such different things. And I'll tell you, one of the places was the adverse effect that because a lot of people aren't trained in diagnosis, aren't trained in using the DSM, don't know that in order to give a diagnosis, there has to be a clinically significant impairment. People in the schools who didn't have that training thought that the adverse effect was just something that has to happen in the schools. And it isn't just something that has to happen in schools. It's something that's considered anytime we consider a category of diagnosis or a category of eligibility. Now, I know there are some people who are still saying, oh, but I believe there are some people who have autism that is correctly diagnosed, but there's not an adverse impact that impacts the student in school. And what I would just encourage you to do there, occasionally there are such individuals, but what I encourage you to do there is make sure that when you're thinking about adverse impact, that you're thinking broadly and that you're not focused. Just keep in mind that some straight A students are eligible for special education under the category of autism, because there's something about their social functioning, their communication functioning, their hygiene, other things that are going to affect their further education, employment, and independent living. It's not about their grades, it's about other ways that the autism impacts them. So probably a lot of people do need to broaden what they think about eligibility, but by and large, autism is autism. So the purpose of special education is to prepare students for further education, employment, and independent living. And when we assess, we need to assess in functional, developmental, and academic areas. When we write an IEP, we need to write functional, developmental, and academic goals. And that way, when the person leaves, when that student with a disability leaves the public schools, we've increased their options for further education, employment, and independent living. But too often, we have left out the functional and developmental aspect in our assessment. We don't even refer kids who aren't doing poorly academically in some way. And then we don't do a good job as including functional and developmental things in their goals and in their programming. And then when people with autism leave the public schools, they are not prepared for further education, employment, and independent living. And we didn't have time to talk about this today, but if you haven't, look at the outcomes for autistic students after they leave high school, because we are doing a horrible job of preparing autistic individuals for further education, employment, and independent living. We are failing the purpose of special education when it comes to this subset of students on the spectrum. So the decision-making process, real quickly, the identification of whether or not they have autism is important. If you're in the private setting, the diagnosis is important, but even more important is the recommendation. So whether this student is eligible under autism or not, the time spent getting interview data, test data, observing the student, and thinking, using your clinical judgment, thinking through what you've observed and what you know about this student, should contribute to excellent recommendations, regardless of whether you end up saying, yes, this student should qualify under the category of autism, or whether that's not what you recommend. These are just the things that we tend to, the things that we need to put into our thinking when we come up with our conclusions. And real quickly, I'll say here that we tend to rely way too heavily on test data. We tend to think of certain tests as the gold standard, and there is no test that's the gold standard for identifying autism. The gold standard for identifying autism is a qualified, trained, experienced team who is able to recognize autism across the spectrum and knows well how the adverse impact of autism could be across areas. So the questions to answer in evaluation are: who is the student and what does the student need? And the reason that I have this image here of this chart full of numbers is, of course, we have to, the law says in a lot of situations, and it's important to have the numbers from tests that verify, that show what our findings were, but make sure that when you are finished, that you have written a description of who is the student and a good description of what they need, that your report is more a description of the student than a bunch of tables and numbers. And I'll tell you, the best compliment you can get after you do an evaluation is for a parent to look at you and go, you got my child, this is my child. And they're not going to do that if it's 15 pages of tables full of numbers. They're going to do that if you reflect who they know. And I'll just, this real quickly, this is a table that sometimes we'll put at the end of reports. And what you'll see is we'll say what the DSM-5 TR says about how they describe autism. And then the middle column, we say how IDEA describes autism. And these are interrelated. Remember how we said, if you look, you could match everything that's in IDEA is in the DSM and vice versa. And then we show in the supporting data column, we show how data that we gathered shows that this student shows these characteristics. So we support it with specifics from the information that we gathered. And what you see here is the underlying characteristics checklist, early intervention. And it's one tool that we find to be very helpful in the process. And this is, I don't know if you know this, but every good presentation has an image of Bob Dylan. So this is Bob Dylan saying you don't need a weatherman to know which way the wind blows. And that's just my way of reminding you, it's not the instrument, it's not the test, it's not, are we using the right test? The question is, are we trained and experienced? Because if you're a good weatherman knows which way is the wind blowing without needing a weather vane. And in the same way, you should begin to have an instinct for and just some skill at recognizing autism, and you never rely on scores from tests. You use them as part of your data, but you never rely on them as the way to make the decision. And then I want to talk about one last thing while we have about a few minutes left here, and that is how important it is for school teams to recognize girls with autism. And if you're in the private setting, how important it is to recognize girls and women with autism. What we know is that fewer females with autism are diagnosed. So most of the data that we gather come from men and boys with autism. So then when our understanding of autism keeps building based on what we know from boys and men. And because of that, we're in this horrible reinforcing cycle of fewer females who have autism being recognized, because we have the male phenotype. What autism looks like, we tend to think of as what it looks like in boys. And remember, we looked at this earlier, 1 in 116 girls and 1 in 27 boys. And what most experts think is that fewer girls do have autism than boys, but probably half of the girls who have autism are going unidentified because we're not doing a good job at recognizing girl autism. And I'm going to show you a series of slides that show that research tends to be based often on male-only participants in brain imaging studies 8 males to every individual female are participants in this particular study found that there are 3 to 6 males for every female in the research that they looked at. And this is an article that came out in September of 2022 that found autism studies are found to habitually exclude women and girls on the spectrum. It was largely due to the fact that in this study, they found that that ADOS was being used a great deal to identify who would participate in studies, and the ADOS missed half of the women and girls who had autism were missed by people using the cutoff points on the ADOS. So we always need to be careful. There's only one instrument that has that I know of that has girl norms, and it's the SRS. And social responsiveness scale 2, and I love that instrument. But a good team is never going to rely on the scores on an instrument, but they're going to find them to be helpful. But certainly, if there are no girl norms, you need to really be hesitant to use the cutoff scores at all, because they're not designed to be able to identify girls and women. So what Francesca Happe, and she's one of my favorite researchers out of the UK who focuses a great deal on girls and women on the spectrum. And she is talking here about the history being based primarily on boys and men, and the research being based primarily on boys and men, leading to a bias. She says, this means that what we think we know about autism from research is actually just what we know about male autism. And so we have to be so careful about using descriptions. And let me just encourage you real quickly. One of the things that I do to better understand female autism, girls and women with autism, is I go to YouTube and I find girls and women on YouTube who have their videos that they post pretty regularly. And you know what? I highly recommend 10 minutes a week, watch a video that's posted on YouTube from different people on the spectrum on YouTube and get a feel for, but I especially encourage you to listen to girls and women and get a feeling for girl autism and what autism looks like in females, because it's different, but it's there. So this is an image that I just love, because I think of this as what it's like for a girl to be recognized with autism compared to what it's like for a boy to be recognized with autism. We're making girls do the hard climbing and struggle before they get identified. And the boys are just going up the escalator because the history of the research is benefiting them in ways it does not benefit. We need to be so careful to be more diligent about recognizing girls on the spectrum. And this is an image that it really rings true to me as well. So the test came back negative, you're free to go. No, there are hardly any tests that have any cutoff points that are valuable for girls and women. If the tests come back negative, look at this poor person. She's falling apart, literally. And this person, this clinician here is relying on what the test and isn't seeing what's right before his eyes. And that's what we do sometimes with girls who are struggling desperately, that we are not recognizing what autism looks like for them. So we need to recognize that we have to be very careful about not using the cutoff scores when they aren't normed on girls. We need to be very careful to recognize that even the questions on many screening instruments are based on the male phenotype, and they're not well designed for girls. We just got to be more open-minded and diligent in recognizing girls. And one thing that I would encourage you to do, this is an instrument that Dr. Grossman and I created. It's called the Underlying Characteristics Checklist. And there are 5 different ones, but 2 of them are self-reports. And so if you're working with students who are 12 or older, you can use the Underlying Characteristic Checklist, the adolescent version. And one of the wonderful things about this is because it's a self-report and it doesn't have cutoff scores, you're just gathering data, and it goes across 8 different areas that are impacted by autism, and ask for the person themselves, the student themselves, to respond to the checklist. And I have watched parents and teachers after the UCC adolescent self-report is completed. I've watched them sit down and discuss the results that came from the self-report and be stunned by the things that the student has recognized in herself that, or in himself, that the adults don't know that they're struggling with, especially students who are able to complete a self-report tend to also be able to mask what they're struggling with. And so a self-report is, I just really encourage you to consider using self-reports with individuals that you're assessing once they have the verbal skills to do that. Yes, and so there's the adult version. I think we talked about that. And real quickly, I don't know how many of you are familiar with Ocali, but it's a wonderful organization in Ohio that has some of the best services and best trainings in the area of autism. And every year they do OcaliCon. And beginning in 2019, they started doing a session where they talked to a panel of women who are on the spectrum about their experiences. And you can still go to Ocali's website and look up, it's different for girls, a conversation with 4 women on the spectrum. And Dr. Grossman, you can see him right there in the far left of that picture. And I was next to him, but you see standing there is Kim Clary. I don't know how many of you know Kim Clary, but she is an autistic woman who also is an occupational therapist. She is brilliant. And she provides so much insight into her experiences being autistic. And this is her speaking there. So I really encourage you to go back to 2019 and go to the podcast and listen to this. Amazing panel of women. And this year, coming up in November, it's after I'm recording this, is a session, Meaningful Connections, a conversation with 3 women on the autism spectrum. And again, Barry Grossman and I got to talk to 3 different women about their relationships that developed since they were childhood. It was one of the most enlightening, amazing discussions, just breathtaking discussions among these women. And if you have a chance to listen to that at some point, I really encourage you to expand your knowledge of women on the spectrum, girls on the spectrum, through this or through other means. So here's my contact information, and I look forward to hearing from you and appreciate your time today.